And so a form of implicit bias is microaggressions. These are everyday, subtle, often unintentional interactions or behaviors that communicate a sort of bias toward a more marginalized group. The difference between a microaggression and a more overt form of discrimination or a macroaggression is that a microaggression, someone who's committing a microaggression might not even be aware that they're doing it. There are three main categories of microaggressions. There's microassault, microinsults, and microinvalidations. So microassault refers to explicit derogatory action or words. Some examples of that would be avoidant behavior. So say you have an LGBTQ2S plus patient and you're reluctant to shake their hand or pat their shoulder like you may do another patient, or you may have an LGBTQ2S plus trainee or student, and you're reluctant to get as close, interact as closely with them as you may another trainee. Leaving someone out of a group discussion, feeling that their opinion is less important, showing negative representations of LGBTQ2S plus people, or even using antiquated and very hurtful words like faggot or dyke, or similar negative words in the presence of an LGBTQ2S person, or even not in the presence of them. These are all microassaults. Another concept, another form of microaggression is microinsults. So these are subtle snubs conveying a hidden insult to the recipient. Examples of that would be, well, you sure don't look or sound gay, assuming that someone to be gay has to look or act a certain way, or asking, how did you turn lesbian, as if it was some sort of choice. Aren't you making life hard for yourself? Assuming that being gay or being lesbian is something that you have control over, and assuming that it means that your life must be terrible. Which one of you is the guy in the relationship? Or I've heard people joke and say, oh, do I have to worry about you fancying me now? Things like that can make someone feel very unwelcome. Another type of microaggression that people may face is microinvalidations. So this is communication that diminishes or negates the thoughts, feelings, or experiences of a minority. Examples of that would be saying, you're being oversensitive. If an LGBTQ2S person is bothered by something or something makes them feel uncomfortable, being told that we're being oversensitive is not helpful. Saying that you're just confused or it's just a phase discredits the feelings that someone is experiencing. Asking, why do you have to flaunt it? Implies that it's something that you have to hide, that's something that you shouldn't feel proud of, something that you should feel is wrong with you. Saying, I'm not homophobic, but whatever comes after the word but there is going to be something invalidating or insulting. And saying things like, you can do what you want, but I don't approve of it, makes it seem like there's like the LGBTQ2S person is choosing to do something immoral or wrong.